Welcome back to the podcast, Heal Without Harm. My name is Dr. Clayton Dir, physical therapist and the one bringing you the truth on the medical system. Today, we've got a special guest that I'm bringing on mostly selfishly to help myself along with my daughters and everybody in my circle. And so her name is Dalanna Hanson. Dalanna like banana is the way that she told me to remember it, and it works rather well. She's a certified specialist in orofacial myology and the owner of Myofunctional Therapy of Kansas. Since 2014, she's been on a mission to help kids and adults breathe better, sleep deeper, and smile brighter. Delana was the first in Kansas to earn this advanced certification, and she's trained extensively in everything from sleep apnea to TMJ disorders to functional breathing. A lifelong learner and passionate educator, she's known for making prevention powerful and practical, helping patients all over the U.S. transform their health through better oral habits. Honestly, I didn't know the last part until just now. You help people all over the U.S.? How do you do that?
We can do telehealth.
Oh, sweet. Okay, cool. We'll chat about that too then, I guess. Delana, welcome to the podcast.
Thank you. It really is an honor to be here. Appreciate it.
It was fun learning about you. I actually learned about you in a very crazy way. So I started posting TikToks 4.5 years ago. A gal on there she was a dental hygienist that essentially what seems like turned into you in a way, in the sense of her path. And I remember her link in bio. The only thing that she had in her bio was like how to find a myofunctional therapist near you.
Oh, okay.
And you were on there. I think you were still over at Love Dentistry. So I actually switched to them, and then you had been you were leaving or something like that. But I'd still reached out and contacted you. And I don't no longer go there either, but that's how I found you. And then I was like, the more I learned, the more I had to learn type of thing.
Yeah. And I started getting referrals from you. I'm like, Dr. Dir, who did? What is this about? I love it.
Exactly. So I'm curious, what got you into myofunctional therapy? And then to follow that, like, what is it? Because most people have no idea what the heck it is.
Right. So my background is in dental hygiene, and that's how it started, is at a continuing ed. I was at a training for tongue ties, and it just blew my mind because we didn't learn about it in school.
Mm-hmm.
And I could sit there and picture all these patients that this related to. I was like, no wonder they're having problems with their back teeth. Their tongue can't reach to self-cleanse. No wonder they've got these swelling on their gums. Their mouth breathing. And it really was a defining moment. It's like where the world slows down. I just zoomed into the instructor and was just peppering her with questions of like, tell me more. And that's how it started. She's like, okay, I see your passion here. I'm getting ready to take a hygienist to Chicago for this intensive 4-day intro course. Would you like to go? Yes. So
that's cool.
Then post-grad training, on and on since then.
So what is myofunctional therapy? Because to me, when I, of course, learned a lot of anatomy, and it's all back to Latin. So I'm like, myo, muscle, function, okay, muscles. But it's like, it's all very specific to your nose and mouth.
Orofacial. Yeah, we just skipped that part. Yeah. But it's the muscles of the head and neck. Wolff's Law talks about how bone responds to pressure. And so these muscles are really strong. So this is what is guiding the jaw to develop. So the pressure telling the bone, say, hey, spread out, make room for me. We want to make sure that things are functioning properly because that's what's giving us room to have straighter teeth, to have a big, broad, open airway so that we can sleep well and breathe well.
Yeah. And I think I see the more, like I said, the more I learned, the more I wanted to learn. And I noticed with my daughter, she's 4.5, just short of 4.5. She's got a tiny little mouth. And I remember when we went to the dentist the first time, or maybe it was even the doctor, like looking in her mouth, they're like, oh, you have a tiny little mouth. And it's like, it's very obvious because her bottom teeth, we floss, we have a rhythm of every 3 nights. And every time it's like, it's just a little bit more back and forth on those 4 bottom teeth. And I'm like, we need to fix this. Because mine were too. Like I had braces, and they had to like grind the teeth a little bit to shrink them widthwise so that there'd be room for them. And now it's like, oh no, like we didn't used to have braces because we had big mouths, plenty of room for teeth, and they should naturally grow in straight. So I'm like seeing this problem kind of like go on. And she also had issues with breastfeeding, and so did her others. And I'm like, well, this is all falling under like what Delana does ultimately.
Yes.
And so when it comes to myofunctional therapy, you kind of talked about how the mouth and everything responds to pressures. Like, what are some common things that people listening right now are like, oh, maybe I should come get this, but they have no idea that myofunctional therapy can help with this? What are some symptoms or dysfunctions that you treat ultimately?
I'd say a big one to watch for is mouth breathing. It's become so common that it's normal, but it's not. If we're at rest, our mouth should be closed. Mm-hmm. Our tongue should be resting on the palate. So that's what's going to help develop the jaw in the most optimal way. And so just noticing that. But also, if you're hearing snoring or teeth grinding or just seeing restlessness in sleep, those are just telling us that things aren't going as well as they should. So it's something to investigate.
Yeah. I know growing up, I have asthma, still have asthma, always was a mouth breather. We always joked how it's like, if I want to breathe, I have to have my mouth open. I couldn't even eat cereal that well because it was like...
You're trying to eat and breathe in your mouth.
Yeah. And I was like, I'm going to eat drowned here type of thing. I actually grinded through caps. They would have to put new caps on my teeth because I would just grind through them. And what kills me, and this is where I really want to get into, is, do you know what the dentist recommended?
A night guard?
A mouthpiece, like a football mouthpiece. I'm like, are you kidding me? Like, let's just, I know you're grinding, but let's just put a cushion there. And I'm like,
it's a Band-Aid.
So, not even solving anything. And plus I would spit the thing out. I have to get a new one every 3 weeks because it would just disappear in my bed.
Yeah.
And so I think my question with that is why? Like, why did he not recommend me to you? Why does nobody, orthodontists or dentist, why do they not recommend coming to you?
Yeah. I think back as being a young hygienist and having this same question. I'm like, okay, I get this. I see why we're telling these people they're wearing their teeth down, they're cracking their teeth. It's because they're stressed out. They need a night guard. But what about all these kids? Like, they don't have a mortgage to worry about. What are they worried about? Why would they be so stressed out? And the dentist, who I really respect, was like, I don't know. Kids just grow out of it. They just do it. And I'm like, so that just festered in the back of my mind. But he gave me the best information that he had at the time. He didn't know what he didn't know. And I think that that's still what a big problem is it's just not mainstream. We didn't learn this in school. And so if we have to do a lot of continuing education, just like in all healthcare fields, but you're going to follow your passion. So as a dentist that is really interested in root canals or implants or Invisalign, that's the courses you're going to go to. And you may never be exposed to airway stuff. So if you don't even know about it, you can't talk about it. Or if you only know a teeny bit about it, you probably aren't going to feel real confident to talk about it.
I don't expect you to have this answer necessarily, but why is it not get into mainstream? I don't understand, why is it so hard? Is it because there's not money to be made? Is it just because people don't know? Like you said, it really is more the ignorance aspect of just not knowing. Because when you can trace everything back to like, well, why? Like you just asked the simple question, why?
Right. Yeah.
It should keep going back to something like, how do we solve this problem? Type of thing. Do you have any thoughts as to truly why it's not integrated more?
Yeah, I think that change is hard for us as a society. I think we all know, like, oh, braces, your kid's just going to need braces. 3 out of 4 kids need braces, but nobody's asking, well, why? Why does everybody need braces? So to your point, but that's just what we know. That's our bread and butter. It's just common. So we think it's normal. We don't know any better to keep asking questions.
I think I'd have to agree with you because even though I fully believe in what you're doing and I expect my kids to utilize your service to help, part of me already knows I'm going to have a discussion with my wife on why I don't want them to go to the ortho first. You know what I mean? Like I'm already preparing for that.
Yeah.
And it's just I would say there's a slight disbelief on but will you be able to help without braces? And I think it's just because, like you said, it's so the expected norm. Right. Progression. It's like, oh, well, if they look like this, then go get braces. It's like, I had braces. My wife had braces. But I also have had cavities all the time. And I always attested to, they said I had hyperplasia or apoplasia, something like that, where the enamel didn't form right. But it's like, maybe it's because I was mouth breathing every hour of the day.
Right.
Maybe it's because they never told me to rinse my mouth out after I took my inhaler and I mouth breathed. I had chapped lips all the time. My nasal cavity is tiny. All of these things, it's like, what the heck? And then I also have ADHD symptoms and I'm like, well, maybe that was that too. And it's like, but I sleep well. I fall right asleep. And it's like, maybe because I'm dead tired because my sleep's not good.
Right.
I mean, yeah, just everything keeps coming back to it. Right. I'm like, son of a gun.
Yeah.
Why did they not tell me ultimately? And so actually, someone that works with us, her kid was potentially going to the ortho, and I was like, you need to reach out to a myofunctional therapist. And I think they're about to get signed up for a tongue tie release. And they actually had it. And so now they're doing the exercises to not let it scar back down and stuff. And I'm like, cool, this is great. Not only did she listen to my recommendation, but is now potentially getting all these benefits that will be indefinite as opposed to just continuous Band-Aids coming back.
It's life-altering.
Yeah.
Getting back on track.
Hugely, yeah. I mean, I think back, I didn't have I don't think I had TMJ type disorders like popping and clicking in the jaw until I had braces. And I put blame on when they started putting rubber bands on and trying to move things. And I don't know if that's direct. I think it is, but I'm not sure. But I just think if I would have had this solved way back then, would have I ever had braces? And some people can see myofunctional therapy as being expensive, but good Lord, braces are expensive.
Right.
You know what I mean? Right. And then now I have to worry about TMJ disorders, potentially headaches. And it's what are all the sequelae of, we'll say, suboptimal treatment decisions when you were 5, when you were 10 type of thing? Hey, it's Clayton. Quick mid-show favor. this episode's got you nodding along or saying, huh, that's interesting, do me a solid. Leave me a review or send it to that one friend who needs to hear it. You'll make my day and maybe save them from another bad doctor's visit. Thank you. Let's get back to the episode. So we talked about some different conditions, but let's talk about kids, I guess. Let's say between ages of 5 and 20. What are some things that kids will show up with in your office that you can help with? We'll talk about mouth specific and then maybe some other symptoms.
Mm-hmm. Yeah, that would be the things to look for, is just noticing how they're resting, how they're breathing, that sort of thing. The biggest symptoms that I treat are definitely teeth grinding, snoring, actually ADHD type behaviors, bedwetting. That's one that most people wouldn't realize could be related. So if you look at ADHD, to your point, like, think of what those symptoms are. If you think someone may have ADHD, they're fidgety, can't sit still, can't hold focus, maybe aggressive, like whatever. Those are the same symptoms as sleep deprivation too. So that's the idea, is like, well, let's just try this first. This is less invasive. It's not throwing medicine at them. Let's just see. And plus, even if they do need that medication, that can interfere with their sleep and make the cycle even more difficult,
it keeps feeding the problem.
Right.
So I think one of my questions, I was laying in bed last night as I was falling asleep, and I was like, I got to ask her this. And I was curious, and I know you're not a psychologist or someone in that realm, but I'm curious, how many people displaying ADHD symptoms or almost like more of a psychiatric or psychological like dysfunction type of thing do you think could be greatly benefited or even potentially solved by just getting deeper sleep?
There is research behind that, actually. That's kind of interesting, because they showed that it is difficult even for a psychologist to diagnose technically, because the symptoms are the same, number one. But also 1 in 3 kids with ADHD snore. That's a lot, right?
That's a lot. Especially kids. Just
that's
the word kids.
Odd. Yeah, that's kind of odd, right? So why don't we just say, they're snoring. Let's dive into that. Let's check their airway. Let's make sure they're getting enough oxygen to their brain at night first. And so that's what I would just recommend, is if you have those suspicions, like they're having trouble sitting still at school or holding focus, or their behavior issues, like, let's just check. This cannot hurt. This is not painful. It's safe. It's natural, effective. Like, let's just try it.
Because I feel like when I hear you make these statements, I feel like every medical professional should have you in mind, because the symptoms can be anywhere, right? So like you go to the doctor and say, my kid can't sit still. Like, well, first of all, I feel like just going down the path of asking why repeatedly would land at your door. But it could be like ADHD type symptoms, not resting at night. We can think dentists, teeth grinding, aligned teeth, not breathing well, chapped lips, the mouth is always open kind of thing. All of these can come back to like, let's make sure you're breathing well. And it's something that I still to this day probably wouldn't even know about if I didn't see that one TikTok, start following that gal. And then, like I said, go down the path to finding you ultimately. And so if we're thinking adults now, I'm guessing it'll be kind of in the same realm, but we're thinking 20, 30 plus. What could I be experiencing now, or what could my loved one be experiencing now that says like, maybe I should have this person assessed by someone like yourself, a myofunctional therapist?
Same thing. And really, to address what you were just saying, you got to think about how the allopathic model, like traditional medicine, that's not what they're trained in. And they're actually trained to be skeptical of anything besides the pharmaceutical methods, honestly.
Touché.
So I treat lots of adults. I've got several women in their 60s right now that are having really good changes. And the biggest things are TMJ problems and snoring, just sleep apnea type issues that they want help with.
Can you help someone who's already on a CPAP or BiPAP come off of it?
I cannot tell someone to go off of their CPAP. They work with their physician to do so. And yes, I do have experience with that they were able to either go off of it or reduce the pressure from it.
Speaking of physician and having to get like certifications or like having someone else kind of like sign off on it, it kills me because I was on TikTok. I made a post and then a comment section kind of went, and it just kills me how PTs are way more educated on what we do, but yet you still have to have this physician sign off. Like, for example, I had a patient last week that I had to refer on a week after she went to the ER. She went to the ER, they x-rayed her knee and sent her out with a hamstring strain. She showed up in my office 5 days later with an undiagnosed hip fracture. She's going to be in surgery in the next couple of weeks. And the ER completely miss it.
Right.
So don't get me wrong, ERs are life-saving. They do amazing stuff.
Right.
But you miss something that basic, and I have to have you sign off when you completely missed a hip fracture that I diagnosed within like 6 minutes of her walking in like this is
I
off.
see it all the time. Moms that are in tears because they know something's wrong, but they asked the doctor and the doctor said, no, tongue ties are a fad. That's just nonsense. Yeah. That's a way for dentists to make money, you know?
Oh my gosh. And it just kills me. So then you have these moms, like you're saying, that are like relatively gaslit and it's like, nope, they're fine. It's like, my kid is not fine. Like, this is not normal. And it just sucks because everything has to go back through the physician, which I appreciate having like a one-stop shop of like, hey, let's just have one layer of check. But sometimes I feel like we need to leave things to the higher educated person in that specialty. That's all I'm asking is it just in that specialty, especially because if you consider physicians, the general primary care physician is an inch deep and a mile wide, right? Like, you come in because you bring your kid in because they're having ADHD symptoms. The next kid's coming in because they're bedwetting constantly. The next kid's coming in because they snore at night. The next person comes in as a 74-year-old who has stomach pain. Then you have a 24-year-old who fell and hurt their knee. Like, that's really a lot of different diagnoses that could be walking through. So this person should be educated enough, in my eyes, to do the first line of check. Like, hey, you're okay. You should go see blank. For this issue. And I think most adults that come in with like significant snoring, where are they normally referred to from a PCP? Like, what's the standard?
That's the gold standard, is the CPAP.
Just go straight to that.
They'll go to get a sleep study.
Okay.
And so the problem is it has a 20% compliance rate. Nobody wants to wear that.
Oh, no. I've never worn one, but I've seen them. It's like this three straps across your face, over the nose, and it's loud. And,
yeah.
Oh, yeah. Yeah. It's like, I would rather you snore next to me than listen to this damn CPAP machine.
Right. So what I do has been shown in the research to treat mild to moderate sleep apnea. So I welcome it. Like, let's try it. And then, yes, if it's severe sleep apnea, that is the gold standard. You need a CPAP to splint you open and force air in so that you're not dying at night.
Yeah.
But can we make it better? Can we tighten and tone those muscles? Can we improve and enhance your nasal breathing so that you're not so dependent upon it? Yeah.
Gosh, this kills me. Okay, so in general, you would say that snoring is 100% not acceptable, not normal, should not be happening.
Yep. Okay. It's not cute.
Perfect.
It's not funny.
Most wives do not think it's cute. Actually, quick question on that. Why, when me and my brother-in-law gain 10 pounds, why do we start snoring, but when we lose it, we stop snoring?
You got it. Yeah.
Well, why?
So that's one of the risk factors for sleep apnea is the girth around your neck, because what's going to cause that is that when we go to bed at night, all these muscles relax, and a lot of times it's kind of floppy, right? And your tongue drops back and clogs that airway. So what's happening is you're trying to force a lot of air through a skinny little tube, basically. And so to your point of like, well, the tube's bigger now because I'm not as fat around my neck, then I can fit more air through there.
Okay.
So this process is, okay, well, can we get some natural expansion? Can we tighten and tone that soft palate area? Can we teach that tongue to get out of the airway, is how Myofunctional would treat that.
Okay.
That's what's causing the snoring.
Yeah.
Turbulence, because you're trying to force a lot of air through a small space, and then those tissues are rattling together.
Okay.
So it's not good. You're losing gray matter.
Gotcha. Oh, gray matter. That's bad. Yeah. Okay, let's go back to almost like origin. So you alluded to that tongue ties may or may not be a fad. We also talked about how more common kids are having more common snoring at night and stuff like that. Are rates increasing? Like, we're seeing more kids with these problems, or are we just becoming more aware of them?
Yes and yes.
Okay,
yes.
Gotcha.
That is why it can be a problem, and why some physicians probably do get justifiably irritated by it, because you probably see it in your profession. Like, you learn something and, now you always see a nail because you have a hammer to hit it with, is like the analogy that people use. So once you finally see like, oh my God, this person has a tongue tie, this person has a tongue tie. And so then it seems like, well, you're just saying everybody has a tongue tie. That's not always the answer. Which
but
I agree
low key
with.
Is everybody have a tongue tie?
There is more, and there's ongoing research with that. Like, what the heck? Why is this happening? Because I do think there's more of awareness. We know what to look for now. We see the repercussions now, if you've had the training. But there is more of it. And
but also, if it seems like there's a lot of things that stem back to a tongue tie, right? So then you have this biased population pool. I remember I saw this female powerlifter. She came in and she was like, "Have you ever worked with powerlifters before?" She was like a little bit skeptical, and I said, I would say 40 to 50% of my clientele is powerlifters. And she was like, "Oh my gosh, is this a bad sport?" And I was like, "Oh, I see why you took it that way." No. all the powerlifters in Wichita see me.
Right.
You know what I mean? It's like, that's it. I was like, it's a total flip of the framing, but you see it as like, oh, this is a bad idea. It's like, no. Every injured powerlifter is probably going to come to me.
Yes. Everybody's coming to me because they have oral dysfunction. Like,
exactly.
And
potentially other things, right?
Yeah.
So it doesn't matter what doctor they show up to. This dysfunction may be stemming back to an oral dysfunction. And so if you're like, well, everybody has a tongue tie, it's like, yeah, because all the healthy people without a tongue tie problem, they're not coming in, you know?
Exactly.
And so there's a huge bias there, no doubt. But so why do you think, if we just say like, okay, let's say incidence is going up, what are your theories as to why?
The research that makes the most sense to me has to do with folate and methylation not happening properly. I think it's dietary. So just like we see neural tube defects and other things happening, we're trying to figure that out with, babies in utero. I think it has something to do with that.
Let's say you just confused the crap out of me. What are you talking about?
Just like how they used to give moms folic acid, and now we're realizing like, no, actually, you probably shouldn't do that if you're not processing it properly. So what a tongue tie is the frenum, the little string under our tongue. We all have it, but it's supposed to disintegrate a little bit away in utero. And when it doesn't, that's called failed apoptosis. That cell didn't disintegrate as much as it should have. And so that's why you see different amounts of it, different tension and tightness and where it attaches in different people. That's when it becomes a problem. We all have a frenum. That's what's attaching the tongue to the floor of the mouth, the lip to the bone. The problem is when it's restrictive, because then that's when it leads to other compensations from other muscles and causes other problems.
So in origin, this is a developmental disorder in utero. So like before baby even comes out.
And there's a genetic component, because if I see families, I very often see like they all have it.
But if we go down this path, if you say it's a certain like chemical that they are not processing properly, it may not be genetic in the sense of like, oh, we're all built this way. It's like, no, you were built. Like, right, in development, you were all built this way because of a certain deficiency or processing dysfunction, which still comes back to genetic, but semantics-wise, it's
epigenetic. Right.
So, real quick, is there a test that someone could do? They're driving in their car right now listening. Is there a test they could do to see if they have a tongue tie? Like, oh yeah, you're probably fine, or like, no, you should probably get that checked out. Yeah. Can they do anything right now?
Yeah, maybe not while you're driving, but you can do it in the mirror.
There you go, safely.
And I do want to give the caveat. I think I am very conservative when it comes to tongue ties. I do not have the hammer that wants it.
You're not just sending everybody out the door.
No, absolutely not. Absolutely not. When you come in for a consultation, I'm going to be looking for that because I'm looking for root cause. And I want to be able to explain to you, this is related.
Yeah.
However, I will never say, go get that clipped, because I think that can make things worse, actually.
Okay.
Because if you don't teach the muscles what they're supposed to be doing, and then, okay, now you have a loose tongue. Cool. How did that really help you? It didn't. And it could make things
That's how I feel sometimes when people have tendinitis and they just want like a stem cell injection immediately. It's like the tendinitis came from somewhere.
Yeah.
Like, don't get me wrong, that may help go faster, speed it up, decrease pain, but it's like you came into this problem initially. Let's fix the reason it was here, as opposed to just continuously like pushing the pain away type of thing.
Precisely.
So I'm with you there.
So I want to do therapy first. Let's see if we can just teach those muscles what they're supposed to be doing. And then if we're functioning properly and habits are good and symptoms are gone, why would we do that procedure?
Exactly. And there's so many people that I've actually had people in my world that they get to there and they're like, yeah, I'm probably going to go and get it anyway. It's like, your only complaint was, I can't like get up, I can't do this without pain, and I can't do this. We've checked all those boxes, but you still want to go get that surgery. It's your life.
Okay.
But what results are you lacking that's going to give you? You know what I mean? Or they'll still get the injection, and you're like, we gave you everything you... Anyway.
Yeah. And that might be why some doctors get irritated, because I know there's a dentist that has offended moms that says, oh yeah, moms just love to talk about tongue ties because they ask about it. And so maybe there are some moms out there that are like, oh yeah, let's just clip it. And that's not a good answer.
For sure. So what's a test that they can do?
Quick and dirty. And actually it's based on research. It's called the tongue range of motion ratio. So I would have you just open wide, see how big you can open. Right? And then do the same thing again, but put the tip of your tongue right behind your teeth.
Now, let me ask you, okay, so tip of the tongue. This is where I think I had a big misunderstanding, and it wasn't until I came in to do a consult with you that I realized like, wow, I thought I was doing this right, but I was doing it wrong.
Okay.
And so what I noticed with you is, or maybe I saw this I was reading something. I thought when you said the tongue should be resting on the palate, I would just smack that whole tongue all the way to the top, like suction it, like every piece of my tongue was touching the top of my mouth, in between my teeth, everything. And then I was reading something, it's like, oh no, say the word in, and where the tip of your tongue touches, that's where it should be. I was like, wait.
You do want to suction the rest of it up, probably about 2/3 of your tongue. So it's not like this forceful, mean thing.
Mine was forceful.
Yeah.
I'm the some is good, more is better. And so I'm like, I'm gonna 10x how fast this goes. And it was not good.
But the N spot, that is a good hack of where do you put it? Because I don't want it resting on your teeth. I don't want it resting low. I don't want it floating. I don't want it too far back. N is a good spot for the tip, and then try to kind of make the rest of it stick to the top.
See, I think, when you swallow, your tongue, like the back of your tongue touches, like I was like hammering that up, like the whole tongue, including that. It was like everything is up. And then I realized like I'm almost like plugging my nose in.
Right.
Like, you know what I mean? It was like creating a different problem. Yeah. So yeah, that was a big help for me. So going back to the thing, open your mouth as big as you can, and then monitor what that looked like. And then say the letter N and just keep the tip of your tongue touching. Open as wide as you can again.
So how much did you have to compensate? How much do you have to close your mouth to be able to reach it? How much did the floor of your mouth lift up to help you? How much of these other perioral muscles jumping in and helping you? So it's pretty normal to have a little bit of adjustment, but that's what I'm looking at. And that is how tongue ties get missed very often, is because people are like, oh, well, he can stick his tongue out really far, or he can do this or that. But it's like, well, actually, if I just gently hold down the floor of his mouth, his tongue isn't going anywhere.
Because when you say the floor of the mouth, it's almost like the origin of the tongue, right? So the tongue the tongue can only go a certain distance. And so it pulls everything that it connects to with it. Gotcha. And so when you say hold it down, are you just like putting your fingers?
Yeah, just right beside that frenum, I would just gently hold it down and see. Now stick your tongue out, because you'll see a difference in that that's what I love to show parents to help them understand. So if someone
has so they do this test, I would say I lose maybe 20 to 30%. This is purely just based off my feel, but I lose 20% of my range of motion. That's not even close to a tongue tie release.
50% and less is what the research says. Like, yes, definitely go get that done. It's a 4-point rating scale. So like a grade 1 is someone's like, that's great mobility, you have no issues. Grade 4 is when everyone, even the janitor, knows that's a tongue tie. Like, they stick their tongue out, it looks heart-shaped. Yes.
Right?
Yes.
Yeah.
And then grade 2 and grade 3, where you got that 50% and above, that's where it's like a gray area, because it may look horrible, but we can get it to function fine, or it may look fine, but it's not functioning properly.
So on this... So you can therapy most of this. My next thought is kids who have struggles with speaking. They have lisps, or they have like poor tongue control. I think most people think speech language pathologist, right? So what are your thoughts on kiddos who can't speak appropriately? Otherwise, neurodevelopment is all normal, but they just can't speak very well. They say their R's weird. They have a lisp of some sort. Should they be going to you, a speech language pathologist, working together? Like, what's your thoughts there?
My clinical experience is when you just said R, I'm like, red flag. That's probably a tongue tie because of having to bunch your tongue, having to elevate the posterior portion, the back part of your tongue. Okay. It's too difficult if that string is pulling it down.
Gotcha.
I need to tell you, speech is not in my scope of practice. I will never go over articulation or help them say that R sound better.
Okay.
However, a lot of times we do notice that speech improves because you're improving muscle function. You're teaching it where it's supposed to start from. You're getting, harmony in the mouth of what's supposed to happen. So even kids that have been in speech for years can see improvement because we can teach the tongue what it's supposed to be doing at rest and at swallow that sometimes isn't worked on in speech. And shockingly, tongue ties and diagnosis of that isn't always worked on in speech. I'm curious your thoughts on this. I, of course, run everything back through PT. So I'm thinking if a coach is working with someone on squat quality, their depth and how strong they are, they may work on it for a long period of time, but if they never catch that their quads don't function well or their ankles are too stiff, you can only get so far with foundational pieces that are poor. And so they may be working on speech a long time, like trying to train this muscle or train this tongue. But if the tongue is weak or the tongue is stuck or the tongue is whatever, you're just going to simply ultimately lose the ability to actually perform because you're missing the basics of strength and range of motion and all that kind of stuff. Yep. Okay. Yep. Gotcha. Man, this is so interesting. Okay. So quick thoughts on braces in general. I know we touched on them a little bit. Are they good? Are they bad? Are they sometimes unnecessary? Are they sometimes necessary? Like, where do you put braces in your thoughts? Ooh. Don't worry, I'll tell all my ortho listeners to not listen. You know what? Wichita's very lucky. We have some very, very good, top-notch orthodontists. Good. So that's good. And there is a place for it. It's the best thing for straightening our teeth. That's not going anywhere. So I just circle back to I just wish there was more of the question, why? Why do 3 out of 4 kids need braces? That's which is
it's a lot.
Right.
Yeah,
right.
for sure.
So that's the main thing is like, well, let's just see if this will help. I never want to promise that they're not going to need braces. That's not my purpose. That's not my point. It can be a sweet side effect. You can see lots of pictures, hundreds of kids that I've treated that is the case, that we either made it to where they don't need braces or it's a shorter, less complex case and better stability. And the orthodontist that I work with will agree.
Mm-hmm.
Yes. So you have better results, shorten, because you've got a lot of kids that the recommended practice is start seeing them at 7 to start monitoring. And so it's pretty fun to see where treatment plans actually change and shorten and get modified because of what we do first before they go to do braces.
Gotcha. So when, let's say someone listening has a kid that's, we'll say just 5 years old, and they're like, some of these symptoms are lining up with my kiddo. Should they bring them right away? Should they consult with their dentist? Should they not tell their dentist? No, I'm just joking.
Their dentist, I don't care. They can ask their dentist. Their dentist may or may not know.
Yeah.
So take it with a grain of salt. It doesn't matter to me if they ask them or not. But yeah, it's worth coming in to see.
Okay.
And just because you come see me doesn't mean we're going to say, yes, you need to start treatment, because I want to get good results, to be quite honest. So if a 5-year-old isn't quite ready, just developmentally to follow instructions and be able to do the exercises at home, we're not going to set ourselves up for failure. Sometimes it's good to wait 6 months to mature. That's my constant balance. I want to start as soon as we see a problem, but I want to get good results too. So.
I know what you mean. Yeah, because sometimes in PT, like, I'm like, oh my gosh, we can help this so much. And they're like, yeah, I'm not going to do any of the stuff you give me. It's like,
right.
Okay, we're not going to waste your time.
Right.
Type of thing. And so then with an adult, you'll be like, all right, well, when you're ready for change, let me know, type of thing. And so what does that first visit look like? Let's say I bring in let's say she was 6, and I bring her in. What can I expect to have her go through with that evaluation with you?
Yeah, it's easy peasy. We just get to know each other. So we're just going to try to untangle what could be symptoms going on and connect dots that parents may not even realize are connected, or help affirm their suspicions. So we're going to be digging into their history, their habits, their sleep. I want to know what's going on. We're going to take some measurements of their mouth. Nothing hurts, nothing's pokey. It's all pretty easy peasy, just talking and deciding if this is something that's helpful, and then developing a treatment plan based on that.
What are some of the treatment, like, what do you do? Because I know in PT, sometimes people are like, how are you supposed to, like, fix my torn rotator cuff? You know, that's the question that I have to answer. It's like, well, what if I told you that the tear is not that bad and your body can actually heal that tear if you just do exercise? It's like easy to me. It's simple to me because I'm on this side and I see it work and I know how it works. To me, it sounds almost like, actually just sounds very hard to believe that you can help straighten my kids' teeth without me strapping a metal bar to all of them. So what are some of the things that you go through to help kiddos who either bedwet, have ADHD symptoms, do teeth grinding, have unstraight teeth? Like, what are some of the things you'll take them through?
Well, that's the premise of functional medicine is, what are you doing to screw things up? Stop doing that thing. And then Mother Nature will take over. Right?
Yeah.
And that's how you see natural changes because of it. So luckily, I have lots of social proof. I have thousands of pictures of kids that I've treated, and they can see before and after is not like, this could happen, like this happens. This is what I do. I'm really good at it. So if they come in and they're wanting to know, what are you going to be doing? The very simple overarching is, I have 4 goals for every patient. Help them breathe through their nose properly. Make sure their lips are sealed at rest. Make sure their tongue is resting properly at rest, unless you're talking or eating, and then make sure they can swallow correctly. So their exercises are going to be based on those things. Help enhance nasal breathing, strengthen those lips, teach that tongue what it's supposed to do, coordinate the swallow. Those are the types of things we'll be doing. And like you said earlier, it's kind of like physical therapy for the mouth. I'm going to give you exercises. You're going to practice at home for a few minutes, a couple times a day. Gotcha.
How often do you normally see people?
I have tried to simplify, again, based on research about neuroplasticity, that our brains can rewire and make new neural pathways and learn these new habits, and my own clinical experience, because I've been doing this a long time. It's usually a year-long program, and they just come in once a month to see me.
Even at the beginning. I think I like that, because with our PT practice, traditional PT is twice a week for 6 weeks, and they kick you out the door, right? It's like what most people know of. So that's 12 visits in 6 weeks. That's a lot. And most of the time, people are like, if I'm coming in that often, I'm not going to do this stuff on my own. And we know in regards of like strengthening and stuff, that's usually a 6 to 12 week process anyway. So you may have just got the ball rolling with this person. You're kicking them out of PT. And so we will generally see people weekly for the first 4 to 8 weeks. So only 8 visits, and we'll have those last 2 to 4 visits, depending on their need, spaced out over the next maybe 2 or 3 months after that initial 2 months. So 4 to 5 months. but it's frustrating sometimes. You know how science works, but then you also have to consider the human, like you said, the mix of neuroplasticity of like how long does this actually take to make change, but also like what does this person need to actually adopt this behavior change, because you have to consider the actual person on the day-to-day. And so I think when you frame it from this will be a year-long process, like that sets the expectations right away.
Yeah, it's not a quick fix.
No, and it's also like I will see you once a month, so you're almost like this coach along the way. Like over the next year, we will get these changes. And so it makes sure it cuts out the quick fix expectations, but actually allows behavior change along the way. I really like that approach. This episode of Heal Without Harm is brought to you by Compelled Fitness, your ultimate partner in Wichita for getting into the best shape of your life. Whether you're aiming for better health, reaching athletic goals, or simply improving your fitness, Compelled Fitness offers programs and services tailored to fit your needs. Don't settle for less than your best. Visit compelled-fitness.com today and start your transformation with expert guidance and personalized fitness. At Compelled Fitness, the goal is helping you become the best version of yourself. I also know you use some sort of mouthpiece appliance or something like that. What are some different gadgets that you'll use along that path?
Yeah, there's lots of tools that we use to try to make things fun, where it's like resistance exercises with the lips or the tongue. There's a removable oral appliance that I really like to use that helps make you learn it passively. It puts your tongue in the right place. You have to close your lips around it, kind of like a football mouth guard thing. Yeah, so there's other things that we can use for passive exercises, but that's my favorite thing, because then you can be playing on the tablet, watching a show, riding in the car, and your muscles are learning muscle memory of what's supposed to be happening.
I also bought this straw thing that's supposed to teach me how to do
replenish.
it. Yeah, what are your thoughts on that?
Like I have one too. My only concern with is just if any rando in the public buys it, you could use it wrong and cause more dysfunction.
What's an example of wrong?
So I have mine in my car, actually. I should have brought it in. But, it's pretty long.
Yeah, it's like 1.5 2 inches long.
You need to put that whole mamma jamma in your mouth.
It comes with a little pamphlet. It tells you to do that.
Okay. I've seen
Which looks funky as weird.
It's hard to use, so kids will gripe about it, and then they'll try to make it easier.
Yeah.
So then you're engaging other muscle, you're just making a new problem. Stop doing that.
You have problem A or problem B.
Yeah. So, but there is validated research behind it that can help with snoring and things like that. So I'm intrigued by it. I have patients that use it.
I would say when I use it, I've discontinued using it, and my wife has gotten mad at me. The thing is they also have a water bottle, but they were out of the water bottles. I would rather just buy it, because I use an Awala. So it feels weird to like shove a straw through the opening, and I'm like, this is again more cumbersome. You have to treat the person, right?
Right.
I'm like, this is annoying. And I also really like drinking water fast, and you can only drink so fast with that, which is kind of the point, I'm sure.
Right.
But I know they say like drink 30 to 60 ounces of water through it per day, and like that's your exercising, at least in a simple way. And I remember the first couple of days, like if I could explain that I had a headache like above my ears, but like behind my ears, but like somewhere in there, I feel like this is what like muscle soreness in the gym feels like, but for like internal muscles. It was the weirdest thing. I'm like, I am so sore, but I can't like touch where.
Yeah.
And I'm sure it's because it was like weak muscles are like burning from
like,
the.
What are you making me do?
Yeah. And the gal that girl on TikTok I told you about, she was like, oh, you should try this. And it's essentially reteaching me how to like breastfeed. That's where it kind of all stems to, right? And so, not to offend any mamas out there or anything, but what are some of the benefits of breastfeeding versus bottle feeding when it just comes to the mouth? Like let's remove the nutritional aspect, and we just think about what does a baby learn when breastfeeding, and what does a baby not learn when going straight to a bottle?
Yeah, the mechanics are completely different. Just like you're pointing out, you've got to use your whole tongue to push and do a peristaltic wave to work to bring that, the lips have to be flanged. Everything's got to be working together to pump the milk out of the breast.
Yeah, actually work to pull.
You got to work for your food. And a bottle, it essentially will drip depending on the bottle that you're using. There's no work needed whatsoever. So
and so what is the trickle-down effect? Is there research behind that on like bottle-fed babies versus breastfed babies and tongue ties, and like those, like we said, you don't get the tongue tie fixed at like 5 years old. You go into braces. You eat like foods that don't require much jaw strengthening. What does that 20-year-old look like compared to the one that's breastfed, eats like whole foods requiring actual chewing every single day, ends up having straight teeth and not really having to get braces? Like, have they done research kind of like longitudinally tracking those kiddos?
There is some stuff about breastfeeding. That's what is interesting, though, is it's not like, oh, there's your smoking gun. As long as you breastfeed, you're going to be good.
Oh, for sure. Yeah.
Even that, I mean, okay, well, what if the mom had a really good supply and it did just flow out easy and the kid didn't have to work?
Yeah, I know some moms that are like that.
Right. Or what if they just figured out a way to clamp down and go for it and use their lips to squeeze it out? Like
that's fair.
Made a compensation too. So even that is tricky, right? Like that's not just the fail-safe thing. But yes, poor moms, they get so much pressure from this. And
oh, good Lord, yeah.
Yeah, I hate that so much. And again, we have some really good lactation consultants here in town that can help it because it shouldn't be so painful. And that's just what people are.
I think that's where, going back to, like I told you, this was a good portion was to help me, is baby number 1 came out breastfeeding like, okay. And then it just got hard. Like I remember months in, it was like my wife sitting in the recliner, baby trying to breastfeed. I was like patting her on the back the whole time. I was just like, please just keep trying. Please keep trying. Please just keep trying. I think we made it, I say we, my wife, I think she made it 9 or 10 months. Her goal was a year. And it just got too dang hard type of thing. And of course, once you introduce the bottle, now you have this like back and forth of like, no, I'm going to fight the boob so that I can just chug the bottle. Right. And then we tried different heads on the bottle and stuff to make it harder to the kind of reverse and like go back and incentivize the breast. And then when we got to baby number 2, I think first of all, breastfeeding was even harder with her. And then I think pretty quick in, we'll say 4 to 6 weeks. I don't know if I knew more about you and just like all this stuff, but I was like, we should get her checked for a tongue tie. And I think we went to I think it was ICT lactation, but a lactation consultant, which, oh my God, was so much better than the ones in the hospital. The ones in the hospital, I could watch 2 hours of TikTok on lactation and be better than them. No actual disrespect, but it was like everything. I was like, could we try this? She's like, you could try that. Well, what should we do? Whatever you feel is right. And I'm like, give me like ideas, like help me with this. And so when we got to this other gal,
that's her passion. That's her...
yeah, it was so much better. And she was like, I think they have a tongue tie, and she ended up getting tongue, lip, and cheek ties all released. Night and day difference. Like immediately breastfeeding much better. Still challenging. Like I've seen many other babies like latch on like way better than what she ended up being, but like she went from like a 2 out of 10 quality to like a 7 or 8 in regards of like how much easier it was. Made it to the year much easier. Which again, going back to the hard on the moms, like the amount of bonding that I know my wife felt like she had with baby number 2 just through the breastfeeding process was so much better, because the first one, I mean, it felt like a fight. Everyone's like, you need to eat this, it's like, talk about like challenging with all the hormones that goes through and like postpartum depression type possibilities. Guilt. Oh my gosh. And it's just like constantly my job was just like, she still loves you. You're fine, and it's like, I get it though. Because when you're emotionally vulnerable and like, this is supposed to be what you're good at, you're a mom, you should be like, there's all of those wrapped up into it, which is just so incredibly challenging.
Right. But so I wanted to say,
go ahead.
It doesn't mean every baby has a tongue tie, but that's the perfect example of why you shouldn't discount it either. Just check.
Yeah.
Right?
I also heard when we were going through this process, a nurse or someone told me, and I was like, I kind of don't believe that. But at the same time, like I know 50, 100 years ago, there's just like, oh, they're fine and they'll just do this anyway. Was there ever a time where nurses, like right as baby would come out, they would just slide their finger under the tongue to check it and potentially even like pop it right there?
Yeah.
So tell me more about that.
Yeah, and some midwives will still clip, and some doctors will do a clip in the hospital. They'll say, "Oh yeah, that is tight," but that's an anterior clip. It's not getting the full. So you may see some improvements in nursing. Hopefully, a lot of times you will, but it's not a complete release. So you may circle back and you're like, "God, they're 7 years old and their teeth are crooked. We did a tongue tie release." Well, there's still some restriction. It's better than it was.
Yeah, but it's a step in the right direction, or it's like it'll catch a portion of them type of thing. What is it like? I picture literally just like a swipe and a pop.
Literally with a fingernail.
And that's enough? Like
it's such a thin little band when they're an infant. It can be. They're doing more sanitary practices now, but yes, there's pictures like in the old days. Yeah.
I mean, I'm going a little bit deep on this, but I mean, is that going to pop it to the sense of like bleeding at that time? Like,
probably
are they breaking that much skin? Okay.
They're not, yeah.
I mean, it's a tiny little baby. It's going to heal in like 14 seconds, I know.
It's collagen. If you're just hitting the frenum, it's just collagen. They're not getting down into the muscle bed and all that stuff.
Gotcha. Okay. That makes sense. Okay, there was somewhere else I wanted to go on this. Oh, I know what it was. Okay, so I snore. And I've been going through it. So I started doing the replenish thing, and it was helping. Well, it is helping. But I also went down the route of like opening up the nose and like taping the mouth. I've tried like 3 or 4 different kinds of mouth tape. And most of them will like come off and all this kind of stuff. And also talk about anxiety, like claustrophobia. You tape your mouth shut when like it's scary to breathe through my nose.
Right.
It's like 3 minutes of deep breathing of like, Clayton, you'll be okay.
Yeah. Yeah.
But I've came down to, I found this one called Dream Tape. It's Dream Recovery is the brand, and they have 3 different kinds. 2 of them go over the whole mouth, and they even do good with like beard stuff. But the one that I really like is their Dream Strips, and it's like a little piece of tape that just kind of, it's maybe a half an inch wide, and it just goes lip to lip. So I can still drink out of a straw through like the side of my mouth if I wanted. I can still breathe out of my mouth if I need to, and I can still talk. And so it really decreases the claustrophobia. But I've been using that because it still keeps my mouth shut.
Yeah.
If all someone did was mouth tape when they sleep and it didn't freak them out or anything, how much do you feel like that's helping them? Or is it just another type of Band-Aid? Like, can there be long-term effects slowly over time with that? What are your thoughts on mouth taping?
I use mouth tape too. Okay. So, and the types that you're talking about, it comes down to preference, I think, honestly. But I don't think that that's just a thing that anyone should just do, because what if you do have a physical obstruction? What if you're congested? What if you have anxiety or panic disorder that hasn't been diagnosed? Like, there are some things, it can be dangerous. Should
there be a step before they just buy it and try it?
Right. You need to make sure none of that stuff is like clogged, that you can breathe through your nose, right? So I do introduce it sometimes in my myofunctional therapy, but I never lead with that. Okay. We do need to make sure that there's no physical obstructions. And we also we'll try it like with certain exercises that we're retraining the breathing pattern, and we'll see how that goes. And we'll maybe try it a little bit during the day for some passive work. And then we can talk about doing it at bedtime. But it's not for everyone.
Okay.
Yeah.
And then nasal strips. The one that I use is that magnet one where it like really pops it open. What are your thoughts on that in general?
Same thing. It can be really helpful. The way that you would know if it's helpful is just like take a breath in. And then the caudal technique is to just manually move your nostrils apart.
Okay, so for people who are just listening, fingers just lateral to your nose,
just and then just pull out. Pull the cheeks apart. Yeah,
it's wild how much that changes.
See, so you would benefit from it.
Oh, I've got videos, and that's intake is like my favorite in regards of like their videos, because you'll have people like look up and they'll and you'll see the nose like and then they pop it on and it's like they have like a pig nose, it's like so drawn out, and you're like and you just hear almost nothing because it's so clear. I'm like, damn, that's like way better, because I've tried all the plastic ones, like Breathe Right, and it's like those do nothing.
Yeah, and then like I like to put on moisturizer, so then it like doesn't stick and all the things. So, but no, if that works and you feel a difference with that, yes, Intake's a great brand. I don't know if you do show notes, I can give a discount code for that, because I am a fan of that. And it does, it just pops it open.
It does.
You can breathe better, and athletes use it too.
For sure. I've every now and then I've even texted him like, hey, I just ran 4 miles and I like nasal breathe the whole time. Very hard. Very, very hard. If you want to make running harder, close your mouth.
Yes.
Ultimately. But I have the intake strips too, and so I've been using them, and it makes it a lot easier. And I think too, on both of these, if anything, it's just a cue. Like what I've really learned is at the end of it, you're trying to create behavior change, strengthening and toning and range of motion, all that. But it requires behavior change first.
Focus, awareness.
Yes. And so just having that strip on there and like seeing it, feeling it, it's like breathe through the nose, breathe through the nose, breathe through the nose. And then the mouth tape, same idea. And that's where I think if anybody wanted to try it, go through the appropriate channels first, right? But like the strips is such a great caveat or baby step, because it keeps the mouth together, it keeps the lips together. So naturally, if you just relax, like you'll have your mouth shut, but you still have like where you can breathe, talk, and drink through the mouth as well. So it kind of removes that scariness. Try to see what else. What are some other things that you've seen in regards of either myths circulating around social media or common misconceptions that we haven't covered that you would like to take the time to kind of dispel?
Maybe something that is picking up for me and I love is that this is not just for kids. I mean, that's my passion. That's probably been 75% of my practice, is because I want to be preventive. I want to treat kids. I want to get them back on track before it progresses. But this helps adults too. So, and you can make a really big impact on adults. I mean, in their appearance, I mean, you've probably seen some of the pictures that I've shown where we can.
Yeah. It's pretty wild. Yeah. It is. It's gnarly. What's a usual turnaround time? So let's say we have a 7-year-old kid. They've got a bit of an overbite. Just like a classic, like weak jaw looking thing. Some of the marketing stuff I've seen on the Dream Recovery mouth tape stuff and on Intake is, again, it's marketing, but they'll talk about how like you don't have a strong jaw, or how do they word it? They essentially tried to allude to like you're more attractive ultimately, if you have a strong jawline, which I think evolutionarily it's probably accurate, but it goes to point out how much you may look different when you have poor mouth or like poor breathing patterns, right? And so if we're thinking of like this 6 or 7-year-old, what are some like visual presentations you may notice if they have poor breathing mechanics? And then how long does it take to kind of help with those or make them completely go away?
Yeah. Everyone's body is different, just like how we learn at a different rate, teeth move at a different rate. We pick up it starts clicking at a different rate. I have some people like with teeth moving. Sometimes within weeks, they're like, oh my God, it's just easier to floss this tooth now, or I'm not biting my lip anymore, or grandma said something's different with her eyes. She just can't pinpoint it, or she's noticing her lips close. Like they'll just see something. And then there are some people are like, I don't know if anything's different. We've been doing it for months. And that's why I do pictures, beginning, middle, and end, because I'm not doing anything forceful. And so it is a slow, gentle process.
If anything, they're doing everything.
They're doing it. Right.
Like you're barely doing anything. It's just like, hey, do more of this. And then, like you said, Mother Nature's like, and we're going to go down this path now.
That's right.
God, that's cool. So, like you said, as short as weeks in regards of initial noticing, do you ever see people longer than a year?
Sometimes. Sometimes we get off track because there's a tongue tie release that needs to be referred for.
That takes time to heal.
There's stuff that messes up the schedule. Sometimes we just need a little bit more help. And so as long as you're doing your part, you're being compliant, and you just need more support, then we'll go longer.
Okay.
But generally, it's sufficient. It should be plenty. If you're doing what I say, I feel very confident that you will get results.
Okay. So let's say someone was listening and they did the tongue tie check thing, right? So they open their mouth really wide. It clucks because they also have Team J probably. And then they do it again. They have their tongue pressed up like the letter N. And they're like, oh, this is a little janky. This isn't as good as we want it to be. But they don't want to call you yet. They're like, no, I'm gonna do some stuff on my own.
Yeah.
What are some 1 or 2 things they should do on their own to just try to help whatever their problem may be?
Yeah, it's so funny because sometimes I hear about that a lot of like, well, I've been following you for years on your Instagram.
Yeah.
I'm like, just call me. I'll answer. I'm not scared.
I know.
I would say lip closure is a big thing to just bring awareness to it and pay attention to it. And the end spot, like, where is my tongue at during the day? What is happening?
Well, there's a whole world going on in your brain, like your brain's picture of your mouth that like no one talks about. It's like, where is your tongue in your mouth right now? And all that kind of stuff. So
and that's
awareness.
What I find is, just the awareness of it. And then usually what people find is it's just easier said than done. I've already given you all the answers. This is what's supposed to be happening. This is how you do it. And then usually even by the end of the consult, the tongue's like, yeah, but this is easier. That's kind of what I'm used to.
Yeah.
Right? So that's why we need to work together a lot of times to help you get it.
Yeah. I do think too, what I've observed in PT is I used to think like, well, if I just give you all the info, you'll be good. Like, I'll tell you what to do. And at 4 weeks, you'll do this. At 8 weeks, you'll do this. And it's like, because I don't like taking people's money over a long period of time. And I also want to work myself out of a job. Like, I don't want you to feel reliant on me. Right. But what I've learned is some people do rely on me, but not because like, oh, I need you to crack my back. I need you to dry needle me. It's like, no, I need to keep showing up here so that between visits, I'm actually doing my stuff because I know I need to come back. Just like, everybody flosses the 3 nights before their dentist and that's it. It's like, yes, like that ends up becoming what it is accountability on those things. And so that's where, again, I like the 12-month thing. We're going to check up once a month kind of thing to make sure you're doing it. But it is nice because I remember when I first started like trying to do more about this, every time I thought about it, my mouth was wide open. And I felt like when I did close my mouth in conversation, everybody around me could see how much I was focused on shutting my damn mouth. Like everybody's like, man, he's really shutting his mouth over here, And then I like look at other people and all their mouths are shut and they're probably thinking the opposite. Like, oh, he doesn't look like a doofus anymore. He doesn't require so much chapstick. All these kinds of things. Because yes, your mouth should be closed. The tongue should be resting just behind the teeth as if you said the letter N. And those are all really good things. To finish out, if someone wants to contact you, most of the people that are listening are in the Kansas area, here in Wichita or surrounding areas. But there are some people literally like in other parts of the world, and I have no idea how they found me in this podcast, but it's growing, which is good. what should they do next? Where can they come follow you? Where's a good place for them? And of course, I'll put this down in the show notes. But where can they find you?
My website might be a good place to start. It's just Myofunctional Therapy of Kansas, because it has a few before and afters. It has kind of some things, common symptoms to look for to kind of help you start thinking about it, and just more FAQs and things of what to expect for treatment. At the top of the website, there's widgets. You can look at my Facebook or Instagram. That's a great place. If you're on Facebook, I would follow me on, it's called Tongue Tamer. On Instagram, it's called myobrace.kansas. And I have tons of before and after pictures, and I try to put educational stuff and just things that this patient noticed this or that, so that you can help say, oh, my kid does that, or I struggle with that, and relate to it.
Yeah.
And you can DM me through those for just a quick question. You can email me through the website. You can just call me and ask me. But you can do a free consult too. A free initial assessment can be booked on the website too.
Okay, perfect. And how long is that? That initial consult?
I plan an hour when we first meet in person, because there's so much education that needs to come from this. Sometimes this is the first time you've heard about it, and I want to help people understand.
For sure. Also, I do recommend what I've found for a lot of clients of mine. There's certain social media accounts that I follow that I feel like put out good information. And what I found for some people is they're not ready to jump in now, right? They're like, let me do some stuff on my own first, right? I've been following you, yada, yada. But really, go follow her on whether it be Facebook or Instagram, because sometimes you need the repeated nudges in the right direction.
Sure.
You know you need to do something about this, but you've lived like this for the last 10 years. So what's, 6 more months is probably your perspective. And so just seeing those like images pop up of like, nope, here's another kid that's helped.
Be better, right?
Here's another person that's helped, right? Like, here's another like scenario of someone thought this was a different type of issue, but was actually helped through myofunctional therapy. Ultimately, like having that on your timeline more often, especially because nowadays, you don't just see things chronologically, right? You see things that you interact with. And so if they go follow you, like a couple posts, they start seeing it more, you may slowly learn some of this information along the way and get a better understanding of how this can be helpful ultimately.
So,
is there any other pieces that you wish we would have covered today? Any other parting thoughts other than close your mouth, tongue in the end position?
We could yap all day.
Oh, for sure. Yeah.
No, I think we covered some really good stuff, and I hope it connected dots for people, or at least made them think about it and want to be a little more curious about something that, a lot of these things are very common, but it doesn't mean that they're normal. So just open your mind, investigate it, and I'd love to help answer questions about it. I
really feel like between airway health, it seems like, is the root of a lot of things. Like if you go up the tree, it can be the I guess down the tree. You could get to the root of a lot of it. And I think PT is the same way as well, because it's like you're going to need PT to avoid surgery or after surgery. Like you're going to need help returning to like a good baseline anyway. So I feel like between the two of us, we could help way more people than people realize. And so that's what I like about this podcast, is I'm able to have these types of conversations and bring people like you on. Honestly, I wouldn't mind having you on every 6 months or so, just to bring people kind of back to it. And maybe we get into more specifics in the future, so where we can get one topic that we kind of hammer on. But if anything, I hope today was a good exposure to everybody on maybe there's another way to help the symptom that no one else can help, ultimately. Hopefully today you guys learned a little bit more on how to heal without harm. Again, my name is Dr. Clayton Dir, physical therapist. All of this information will be down in the show notes. And so go down and click on all the links that you would like to click on. And Delana, thank you again for coming on today.